Most common diseases in the elderly, a scientific overview. As the human body ages, physiological changes naturally occur. Every cell, tissue, and organ gradually slows its functions. This is part of the natural aging process. However, if a healthy lifestyle is not maintained, these changes can lead to the development of chronic diseases. Below is a detailed scientific explanation of the most common illnesses among older adults, their causes, symptoms, and prevention strategies. Cardiovascular diseases. The heart and blood vessels are the engine of the human body. As people age, the arteries lose their elasticity and may develop atherosclerotic plaques, which restrict blood flow. This leads to conditions such as ischemic heart disease, heart failure, and stroke. Scientific fact: according to Harvard Medical School, about 70% of people over 65 show symptoms of cardiovascular disease. More than 80% of individuals with blood pressure above 140 over 90 millimeters of mercury are elderly. Prevention. Limit salt intake, less than 5 grams per day. Walk at least 30 minutes daily. Eat foods rich in omega-3 fatty acids, fish, olive oil. Manage stress effectively. Type 2 diabetes. In older adults, the body's response to insulin weakens. A condition known as insulin resistance. Prolonged high blood sugar levels damage the heart, kidneys, eyes, and nervous system. Scientific fact: according to the World Health Organization, 1 in 6 people over 60 lives with type 2 diabetes. Symptoms: fatigue, thirst, frequent urination, blurred vision, slow wound healing. Prevention: limit sugary foods and drinks. Stay physically active. Eat fiber-rich foods like greens and vegetables. Joint and bone disorders: arthritis, arthrosis, osteoporosis. With age, joint fluid decreases, cartilage becomes thinner, and bones lose calcium, becoming more fragile. This causes pain, swelling, and restricted movement. Scientific fact: according to the American College of Rheumatology, about 60% of people over 65 have symptoms of arthritis or arthrosis. Women lose bone density 30% faster than men. Prevention: increase calcium and vitamin D intake. Spend 15 minutes daily in sunlight. Maintain a healthy weight. Alzheimer's disease and dementia. These conditions are caused by the gradual destruction of brain nerve cells, leading to memory loss and cognitive decline. Scientific fact: who reports that 1 new case of dementia is diagnosed every 3 seconds globally. 1 in 4 people over 70 experiences some form of cognitive impairment. Symptoms: forgetting names and familiar places. Difficulty completing daily tasks. Mood swings and depression. Prevention: engage in mental activities, reading puzzles. Get enough quality sleep. Consume foods rich in omega-3 and B vitamins. Vision and hearing disorders. Age-related problems such as cataracts, glaucoma, and hearing loss are very common. These are mainly caused by oxidative stress and degeneration of nerve cells. Scientific fact: according to the American Academy of Ophthalmology, nearly 50% of people over 70 show signs of cataracts. Prevention: eat foods rich in lutein and vitamin A. Protect your ears from loud N. Kidney and urinary tract diseases. Kidneys lose their ability to filter blood effectively as people age, causing toxins to build up in the body. Scientific fact: nephrology studies show that after age 70, kidney filtration decreases by about 1% each year. Prevention: drink 15 to 2 liters of water daily. Reduce salt intake. Avoid self-medicating without medical supervision. Digestive system problems. Older adults often experience lower stomach acid levels, slower liver function, constipation, and bloating. Scientific fact: gastroenterologists report that after age 65, digestive enzymes decrease by 30%, making nutrient absorption more difficult. Prevention: eat more greens, fruits, and vegetables. Stay hydrated. Stay physically active. Depression and insomnia. Mental health is just as important as physical health. In old age, loneliness, life changes, and the loss of loved ones can lead to depression and sleep disorders. Scientific fact: according to WHO, 20% of people over 65 experience depression, and insomnia increases this risk significantly. Prevention: stay socially connected. Spend time outdoors. Seek psychological support if needed. Weakened immune system. Aging slows down the immune system, making older adults more susceptible to infections. Scientific fact: immunology studies reveal that lymphocyte activity in individuals over 70 is reduced by nearly 50%. Prevention. Eat foods rich in vitamins C, E, and zinc. Sleep well and manage stress. Cancer. With age, cell regeneration slows down and DNA mutations accumulate, increasing the risk of cancer. Scientific fact: according to the American Cancer Society, 60% of all cancer cases occur in people aged 65 and older. The most common types are lung, colon, prostate, and breast cancer. Prevention. Quit smoking. Eat a balanced, antioxidant-rich diet. Exercise regularly. Conclusion. Aging is not a disease. It is a natural stage of life. However, maintaining a healthy diet, staying physically active, getting enough sleep, and treating and preventing common diseases in the elderly, heart, diabetes, bone, and joint health. As people age, their bodies naturally undergo changes that make them more vulnerable to certain diseases. However, many of these conditions can be prevented or managed effectively through lifestyle adjustments, proper nutrition, and regular medical care. Let's explore the most common age-related diseases and the scientific ways to prevent and treat them. Heart diseases and high blood pressure. Cardiovascular diseases are among the leading causes of death among older adults. The heart muscle becomes weaker over time, and blood vessels lose their elasticity, leading to conditions such as high blood pressure, atherosclerosis, and heart failure. Prevention methods. Eat foods rich in omega-3 fatty acids, such as fish, flaxseed, and walnuts, to strengthen the heart. Limit salt and saturated fats to maintain healthy blood pressure. Consume more vegetables, fruits, and whole grains to improve circulation. Avoid smoking and excessive alcohol consumption, as both significantly increase the risk of heart disease. Engage in daily physical activity, such as walking, stretching, or light exercise. Treatment and care. People with heart disease should follow a diet prescribed by their doctor, maintain a healthy weight, and take medications regularly. Drugs like ACE inhibitors, beta blockers, and statins can help regulate blood pressure and cholesterol levels. Regular checkups, electrocardiograms, and blood tests are essential for monitoring heart health. Type 2 diabetes. Type 2 diabetes is common in older adults due to reduced insulin sensitivity and slower metabolism. Uncontrolled blood sugar levels can damage the heart, kidneys, eyes, and nerves. Scientific prevention tips. Follow a balanced diet with limited refined sugar and processed foods. Focus on high-fiber foods such as oats, apples, beans, and leafy greens to regulate blood sugar. Maintain a healthy Alzheimer's, vision and hearing loss, kidney and digestive diseases, and mental health in the elderly. Alzheimer's disease and memory decline. One of the most serious conditions affecting older adults is Alzheimer's disease, a progressive brain disorder that slowly destroys memory and cognitive abilities. It develops when nerve cells in the brain deteriorate due to the buildup of amyloid plaques and tau proteins. Scientific prevention strategies. Keep the brain active with reading, puzzles, and learning new skills. Maintain a healthy diet rich in antioxidants, blueberries, green vegetables, nuts. Exercise regularly to improve blood flow to the brain. Ensure quality sleep of 7 to 8 hours per night to help the brain recover. Manage stress levels through meditation or breathing exercises. Treatment. Although Alzheimer's has no complete cure, certain medications such as donepezil, rivastigmine, or memantine can help slow the progression of symptoms. Cognitive therapy and strong emotional support from family members are also essential for maintaining mental stability and quality of life. Vision and hearing loss. As people age, the eyes and ears also undergo changes. Cataracts, macular degeneration, and glaucoma are common causes of vision loss, while hearing loss often results from damage to the inner ear. How to protect eyesight and hearing. Eat foods rich in vitamin A and lutein, carrots, spinach, eggs. Avoid direct sunlight and use UV protective glasses. Schedule annual eye and ear checkups to detect issues early. Avoid loud noises and limit headphone use. Keep blood sugar and cholesterol levels normal, as they affect blood flow to the eyes and ears. Treatment. Cataracts can be removed surgically, restoring vision. For hearing loss, hearing aids and auditory therapy can greatly improve communication. Doctors may also recommend eye drops to reduce pressure in cases of glaucoma. Kidney diseases. Kidney function gradually decreases